every piece of peer-reviewed research that you'll find about substance use disorder says that group treatment is the most effective way to help people change, because they're put around people
that they can relate to
who understand them. Even if the facilitator of the group isn't somebody with lived experience,
it allows them to not have to have it.
Yeah.
Because as long as you can facilitate that kind of relatability, then it helps them feel like you're not alone. And I mean, that's true of a lot of things, but
everything almost.
But definitely it's a huge priority for people struggling with addiction, because nowhere that I can think of, maybe outside of just trauma, and oftentimes they're very well connected, do you need some sense of hope?
Yeah.
And, and I think that's really critical. And how is a therapist who doesn't really know what you're going through able to instill that hope? You need somebody to kind of relate to. I mean, there's things that therapists can do to kind of help and make you feel comfortable and safe and all those things. But the power of the group is undeniable. Yeah.
And so being able to provide that service, we've been running it since May of 2015. We've had a lot of really wonderful success stories come out of that program. We have people who are currently enrolled in college to be things like chemical dependency counselors, veterinary techs. Like, we have people teaching classes at municipal court and being employed in the recovery field. Like, we have had a lot of success with the way that we approach our implementation of IOP. And I think the way that we implement IOP at the agency is very different from how other people do. And that was kind of just the way that it naturally happened when Mike and I set it up. I was very black and white and clinical, and he was very like, no, that doesn't work with addicts. Please listen to me, Janice.
Right.
And so the two of us worked together long enough that we found this balance in the middle where we can teach people clinical skills, but we can also, and it's very opposite of how I was taught to approach treatment when I was in school. We say things like, I love you. And we hug people, and we talk about God, and we talk about spirituality, and we encourage people to find higher powers. And we always say, like, we will love you until you can figure out how to have love for yourself. And we mean it when we say it, and it looks very different from other treatment implementations, as it should, because every addict needs something different to get well.
Well, I was thinking when I was working in residential for kids, adolescents, and we would get them and I would run like drug and alcohol groups for them. And I remember just staff would always say, you just got to get rid of your friends. You got to go back. When you get back home, you got to get rid of your friends. And it's like, well, that's great and all, but like, then they're going to have nobody. Then they're like all alone. And there's no way that they're going to really listen to that. And so I think what you're describing is, the ones that the friends that they're using with and that are kind of co-conspirating into the drug use, you guys can't operate that way together at this point. So there has to be another option so that people can, because that relationship is so important. If we're alone, then we're going to certainly fall more in love with the drug than we will with anybody else.
And my experience, so I love when people are like, okay, but what if you run into like so-and-so at Speedway? Right. And I was like, okay, well, when they see you, first of all, they will probably be able to tell by your appearance that you're not on drugs. You're not using drugs and like maybe like something's different about you. Or if you speak to them and you're like even just a little bit serious about your recovery and you're able to like voice that to them, they will want nothing to do with you, okay? So I know for myself, I don't like focusing on like, you need to get rid of your friends. Like instead of like, you just need to try something else. Because for me, all of my friends were drug addicts. And so when I tried this other thing and I got involved in this other fellowship, those people became my friends. And I had no desire to talk to these people. And I still see people. I live in Marietta. That's where I used at. And I see people all the time, but like, I'll just say hi and, they may speak or, whatever, but it's not
way more powerful when you're able to come to that conclusion.
Yeah.
That, I've found another network of folks that I can feel good with and don't need to use drugs with this group. I had to with the other group, but not this group.
Yeah. Because we all want to like belong. We all want to feel a part of something. And that was, for me, I always, looking back, I I feel like I started experimenting and partying and stuff because not that I didn't like fit in, like I ran with like the popular crowd in school, but I was always like scared of not fitting in. So I would do whatever I could.
Don't want to be rejected.
Yeah.
Don't want to
To
be,
like have a
yeah.
group of people.
Yeah. And so I would like do anything to like feel a part of. And then it led me into this very dark place. But, and so that's still true. Like I still want to be a part of, I have to be a part of something in my life will look much different than Janice's life. You know, Janice is happy and content when she has to be quarantined for 14 days. Abby is not.
Yeah.
Okay.
Abby's
Abby
miserable.
needs people. And my husband is the same way. He needs people. He loves to be
Needs that
surrounded by
social, yeah.
people. And that's how our life is. And that's probably how it will always be. So I think it's just important that like when people are coming in and like trying to figure this out, like we can't hound them and be like, you have to get rid of all those friends. Well, yes, we know they do. They got to go. And they will. Naturally, they'll just kind of dissolve.